Hi, my name is Hannah Grissom. I'm going to be presenting Iontophoresis. I'm also going to be demonstrating the practical application side of it, as well as explaining what the therapeutic effects, indications, and contraindications are. Your therapeutic effects is that it has an anesthesic use. It also is good for pain relief. It works on the gate theory of pain or on the endogenous opioid system. You can also use it to help decrease inflammation, decrease the size of calcium deposits. The indications are going to be acute and chronic inflammation, pain relief, and drug administration via the soluble salts and drug ions through the skin and into the tissue. Your contraindications are pacemaker, damage on the skin on the treated area, and any kind of drug allergies to the medication that's going to be delivered transdermally, and you don't want to do this transcranially across the brain, obviously, and you don't want to use it in the orbital areas over the eyes. All right, and so during the application process, you want to be fully aware of the fact that they have 4 most common drugs that will be used. The common drugs are dexamethasone and acetate, which are both negative, and your positive 2 are hydrocortisone and lidocaine. Right? The first thing you want to do to make any kind of patient comfortable is to introduce yourself. So I'm Hannah.
Oh.
Nice to meet you. And you want to talk them through the steps so that they're very and completely comfortable with what's about to happen. I'm going to be using hydrocortisone, and we're going to be using it on your arm to help with the pain. You might feel a slight tingling. Some people don't feel anything. It all depends on how it's been applied. Okay? And then you're going to want to clean the area properly using an alcohol pad. And you don't want to use one that's already been used or that's open. So you want to start with a sterile pad. Okay? Here's some here. And while cleaning the skin, you also want to check and make sure that there's not any irritation or anything that would contraindicate using and applying Iontophoresis. I'm going to let that dry for a second. You also want to be able to get the proper medication drawn once you have your pads open. You also do not want to use pre-used application pads. So you also want to start with a fresh pouch. You're going to take your medication and using an eyedropper or a syringe, you want to insert it onto the applicator or to the active pad, and you want to put it in the felt center of the spot. Like I said, we're going to be using hydrocortisone, which is positive, so you also want to make sure you note that because it is important to know what type of medication and whether it is positive or negative. Okay? Also, if you're using a syringe, just to help the patient feel comfortable, be sure to explain to them that I'm not going to inject some needles into you. It is just for the medication purposes. Once I have the medication applied, I'm going to apply the Iontophoresis pad with medication onto the spot of pain. Okay. Now it is positive, so you want to use the positive lead to hook it up to it. So I'm going to go ahead and do that. Okay. Now you also want to use the disperser pad. It needs to be appropriate amount away. So the disperser pad needs to be 3 to 6 inches or 8 to 15 centimeters away from your active lead. You also want to understand how much of the drug that you use, because depending on how much you use, also depends on how much you want to apply transdermally at a time. So you would, for 40 mA, it's going to be for 1 minute. Also, you're going to have 2 a minute, for 20 minutes, 3 mA 13.5 minutes, and 4MA for 20 minutes. We're going to be applying 2, so it's going to be 20 minutes. Right. All right. And while that's applying, it's going to take just about 20 minutes to apply. And there's your application. When it's all finished, and as you remove the pads, you want to double check and make sure that there's no irritation or anything. But also, in a preventative measure, if you know that they might have some kind of allergic reaction to the pads themselves with the adhesive, you can always help reduce that risk by increasing the size of the pad and applying a Viragel after, or even increase the spacing of the pads. And there's iontophoresis.